Do you guys ever get questions about why X-ray is so important?
Yeah, lots of people come in. I think most people expect that we can see everywhere in your mouth. But what people don't realise is right where your teeth join together, we physically can't see that area, and that's the area that most of your plaque sits. So it's really important to have a look at there, because often a area of decay can be starting, and the only time that you can actually see it through the top of the tooth is often when it's too late, because it's got to the stage where it's so large that it's broken through the top of the tooth. But again, if we take X-rays, we can catch things when they're early.
And a lot of people are a bit worried about radiation, but these days
it's dental X-rays is so good. One of the little X-rays that we take inside your mouth is the equivalent to 1 hour of sunlight.
Exactly. And the other thing I've heard is you actually get more radiation from standing next to a bunch of bananas in your kitchen.
Oh, really?
So there you go. Than a dental X-ray. So they are really safe, and the best way, again, is preventative, to find something when it's small, and we can fix it when it's just a little filling. It's going to last you a lot longer than a larger filling that may need further work.
We also take full head X-rays as part of our new patient special, that's standard, and that's really good to have a look at all the roots of the teeth, the sinuses, the jaw joints, and just make sure that there's nothing happening in the jaws that we can't, again, physically see ourselves. And again, in terms of the dosage of radiation, it's the equivalent of having a flight over to Europe. So lots of people have been on a plane before, so it's, in terms of X-rays, there's something that once upon a time, they were something that you had to be really, I guess, cautious of. But these days they're very safe, and they're part of a really good preventative plan for your teeth.
And it gives us something, you know, every time we see our patients, every 6 months or so, we've got an initial basis to work back from and see what is changing.
Well, that's why the photos we take are so important as
well.
Yeah,
like you get people saying, why are you taking photos of my teeth? But it's such a useful tool. Like, I can't tell you guys how many times I've looked back at those photos we've taken, and you can see, is the wear changing? Is something, does this look the same?
Moving?
It's really great
So you take
information.
them to keep them as a baseline record.
Absolutely.
Like something to compare to the future.
And as well, we can show our patients as well what you know, what's going on inside their mouths too. It's really useful.
Yeah, I agree. I guess with that too, it's a really good idea to keep coming to the same dentist, because we do have an initial record to follow up from. If you go somewhere else, they may not know that there's perhaps a crack in a tooth. It's been like that for decades, and then they might want to crown it or do a filling or something, and you may not necessarily need it. So if you keep going to your same dentist and following up, then we can make a long-term plan for you and your family.
Care.
Exactly.
Sure. So now we were running a Facebook post about